Good afternoon. I'd like to thank Andy O'Grady for his kind words and express my appreciation and thanks to the Board of Directors for the prestigious Van Bramer Award bestowed upon me. I feel honored and appreciate the recognition of my contribution over the years to the mental health system here in Dutchess County. I would be remiss, though, if I didn't recognize a group of mental health professionals that, for most, if not all, the 35 years, have been by my side, advising me, counseling me, challenging me, and ultimately implementing our shared vision of what a mental health system should look like. They are Dr. Ben Hayden, himself a recipient of the Van Bramer Award, Alan Krause, Frank DeSerbo, Bonnie Shear, Marianne Lowry, and finally, our current Division Chief for Clinical Services, Margaret Hurst. I share the Van Bramer Award with them. I'm very proud of what we've accomplished over the years, expanding and refining the mental hygiene system. But I'm also aware and acknowledge those achievements wouldn't have been possible without the support of the 3 county executives I've worked with and for, namely Lucille Pattison, Bill Steinhaus, and Mark Molinaro. But I'm also proud of the work we've done with the MHA in the areas of education, advocacy, case management, and treatment. I've had tremendous respect for the work of the MHA and am pleased to report my working relationship with each of the agency's executive directors has been positive and productive. To give you an idea of how close the working relationship has been, when I began November 26, 1979, almost exactly 35 and a half years ago, the entire administrative organization of the Mental Health Association was located down the hall from my office on the 2nd floor of the Mental Health Center. Joan Lanning, executive director at that time, her office is currently occupied by Margaret Hurst. Andy O'Grady is a different story. Andy, before becoming the agency's executive director, before becoming the assistant executive director, before becoming the director of case management services, was working as a social worker for the Department of Mental Hygiene. Alan Krause and I encouraged Andy to apply for the position at the case management unit, and the rest is history. Yes. But one could say that the Department of Mental Hygiene gave a gift to the Mental Health Association. But I'm pleased to say that gift has been reciprocated. Over the last month, Andy has hired 4 people, 4 professionals, to work as shared staff in the department's mobile crisis intervention team. And without those additional staff, we wouldn't have been able to expand our hours. Because of that contribution, we're going from 12 hours a day to 24 hours a day, 7 days a week. Thank you. Mental Health America. As the Department of Mental Hygiene morphs into the new Department of Behavioral and Community Health, I expect its relationship with the agency, with Mental Health America, will continue to be positive, productive, and constructive. And I will continue to be a resource. I'm retiring from my county position, but I'm not retiring from my private practice, and I'm not retiring from the community. I will continue to live and work in my house on Spur Way in the town of Poughkeepsie. And to the extent I can be of assistance to Mental Health America in whatever way, professionally, personally, I will consider it a privilege to serve. So thank you again for honoring me. Thank you for the Van Bramer Award. Long live Mental Health America. What you do is vital, essential. You make a difference in people's lives. Stay healthy, stay in touch. God bless.